This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
Enter the
Supposed
second
to
part.
help us or
Medical Dilemma.
Hello, my name's Harry Tambuatco. No, it's supposed to be Sunny Del Rosario, but he's off right now, so I'm going to sit in for him. No comedy, we'll go straight to the issues at hand. The topic at this point is going to be pregnancy and contraception. Now, if you notice, I didn't say abortion. Now, we have many issues that surround these two topics and this expertise, medical expertise. In this first part, what we will do is we will talk to two experts, a mother and daughter, who are both experts in the field of gynecology and being an obstetrician. Thereafter, we will bring in Dr. Sanchez. We have Father Jerry Manlangit. We don't have attorney Sarah Jane Sugitan. At that point, we will tackle the different dilemmas that surround these issues. Hello, ladies. Doktora, maraming salamat you're both here.
Yes.
Let's start with Belen. You're Mrs. Belen Rajagukguk. Is that correct? What an interesting name. This is Indonesian.
My husband is Indonesian.
Your husband's Indonesian. But he's not a practicing doctor.
No.
Kayo lang.
Kayo lang.
Why were you a doctor? Just a very quick. Your
My father is a doctor.
Ah, okay. So it's
We have a
Philippines.
hospital in the Batangas.
Oh my gosh, you got a hospital. Baka MVP is looking for more hospitals. I understand, mga 15 na nabili niyan.
Oo.
Hindi ba parang ganon? Now, let's see. You are a fellow obstetrician and gynecologist, the Philippine Obstetrical and Gynecological Society.
Yes.
This is correct. And you're practicing in Batangas in your hospital or also here in Manila? At the Makati Medical Center, if I'm not
Makati
mistaken.
Medical Center and Adventist Medical
Adventist
Center.
Medical, okay. Now, your daughter, Irma, to my left, is, let's see, Irma Rajagukguk-Magnaye.
Yes po.
MD. And you're also an expert, well, you're also in the medical practice as an obstetrician
That's right.
and gynecologist.
Yes.
Ba't ka sumunod sa nanay mo? O sinabi niya sa inyo, kaya mag-doktor kayo lahat!
No, I grew up with my mom in the hospital
Right.
because the school is near the hospital. So I saw her work. I was thinking, maganda to. Maganda yung trabaho niya. So I also love what I do. Yeah.
You mean you did not see the rigors, the pain, the hardships of being a doctor?
I
Because
also saw it.
it's continuous study.
Yeah.
And to a point, sometimes, you actually neglect family. Di ba? Correct me if I'm wrong. Hindi ka ba na-feel neglected? Naging doktor ka pa?
Hindi naman po. She was also always there on the, what you call this, the milestones of my life. She was always there. So didn't feel neglected at all.
So you find it an advantage having your family owning a hospital and your mother being the expert as well all these years. But you don't practice in the same hospital in Metro Manila.
We do practice in the same hospital,
same hospital.
Adventist Medical Center
Right.
Manila. And then she practices also in Makati Medical Center.
What are the new issues surrounding this expertise or being an obstetrician and gynecologist? Anong naiiba na ngayon nowadays? I mean, from her practice going to your practice, maraming new scientific developments, innovations, changes, new practices?
Almost all are the same except that
the baby comes out the same way.
Yes, the technique's the same, but the diagnostics are different.
Naiba na.
It's more advanced. And then now there's endoscopy or laparoscopic surgery, which is good. You make small incisions and do the same adnexal surgeries as the big incisions before.
So naiba na ang practice,
Medyo
basically.
po, medyo, yeah.
During your time and now, there's a lot of changes. Maraming innovations now. Ibang-iba na from the time you started, or your father being the doctor.
My father was a general practitioner.
A general
so
practitioner.
He does everything. He did
Literally.
everything.
So bagay, gano'n naman sa probinsya in those days. You're talking about early 1950s, no? So he has to do everything literally. From cancer to head pains to breaking your toenails. Di ba?
Sanay
All the
po
way.
siya kasi US Army siya.
sanay. But you're both practicing, do you still have time for your family? You're Magnaye, so you're married.
Yes,
You have
yes,
kids
yes.
as well.
Yes,
Don't tell
I-
me you wanted to become a doctor as well.
I don't know. I'll let them decide. But I have 2 kids. I have 1 son and 1 daughter. And I'm happily married. We're celebrating our 10th year anniversary.
Why did you emphasize happily married?
Because parang some people might think if you're a doctor and you're a woman, it's hard.
Even for a man. I mean, not for anything, but the work of doctors, medical doctors, it takes all your time, di ba, in the hospital. I mean, I watch Grey's Anatomy. I can see what goes on. It's terrible.
Yeah.
I mean, the work, di ba? Plus, having to read up on new science, new medicines, new innovations, new techniques, new equipment, like you were saying.
We have conferences and conventions that we attend to update ourselves. So it makes it easier for us to learn more in a quick, small span of time.
In a very general sort of way, let me ask you this question. What is the state of the medicine of gynecology, obstetrics in the Philippines today? If you were to answer that question very quickly, how would you answer that in general terms? Kamusta yung kondisyon sa Pilipinas in your field? Kayo po, Dr. Belen.
Well, marami pa rin tayong home deliveries sa probinsya. But in Metro Manila, our patients are going to the hospital. The challenge really are in the provinces.
Kasi kung malayo nga naman ang hospital,
Opo.
I mean, it's not a matter of choice. Can we call that a dilemma?
Yes, opo. Pero ngayon po, ang mga health centers natin, tinetrain na po ang midwives para magkaroon ng better
Can the midwife
expertise.
do what you do? Kaya ba nila? Diba? Kung nagkomplikasyon. I've exposed to the midwives, masalan sa mga libliban, mga fishermen areas. Nakikita ko and I've heard a lot of horror stories as well. And some of them, they seem to just pop it out like rabbits. Di ba? Nakakatuwa eh. And parang ang titigas din ng mga bata paglabas, di ba? What is the state or that condition today? It's changing for the better. They're going to hospitals now.
They're going to health centers and to hospitals.
Ang health center ba maayos?
Now,
You smile. No, I'm not being derogatory, but it's better to have a health center than zero.
better than home deliveries.
Oh, better.
Better than home deliveries.
Oh, kasi noon pupunta sa bahay mo, no, yung midwife, and they do that. Well, we see it in the movies.
Because
At saka po yung with the advent of HMO po, health maintenance, mga insurance, then the patients can afford more. The
malaking
healthcare,
bagay,
at saka yung mga hospital po, we have packages na. In the hospitals, maternity packages, something like that, that the patient will have given with reasonable packages, the patients or women now.
Nakakatulong ba ang gobyerno pagdating dyan sa safety net? May tulong ba gobyerno?
May PhilHealth po tayo.
Hindi, pero nakakatulong pag may nanganganak. Papasok ang gobyerno, sasaluhin nila.
May PhilHealth na rin po. Kahit po sa panganak, may PhilHealth din
Maski
po.
pa paano,
Kahit pa
malaking
paano,
tulong.
nakakatulong din po.
But the health centers need a lot of improvement, or pwede na as they are? Of course.
Of
We're
course,
in the Philippines,
of course.
It's like the MRT.
they still need improvement, but it's a better now than compared to before because they have meds there, they have consults there, they have vaccinations there. So I think it's better
May
compared
OR
to
din
before.
ba mga health center natin?
Hindi ko
Maski
po
pa paano.
sigurado, palagi
Maski
ko wala.
makeshift OR. Right? Like your husband would have been used to this, being an army doctor, di ba?
My father.
Your father, I mean, sanay sa ganon because I watch MASH. MASH, puro mga doktor. I love MASH.
Old style doctor yun,
Oh,
di ba, ma'am?
Korean War kasi yun. But the conditions there that I see in those makeshift operating rooms seem to be very hygienic, maayos naman eh. I'm not sure I've seen the health center to look like that.
I don't think they have an OR in the health center.
That's what I was saying.
Yeah.
So kung nanganganak ka nun, sa lamesa ka lang, tabi kayo dyan, higa ka dyan.
Usually they have probably a delivery room.
Hindi OR ang
Delivery room is for normal deliveries.
You
In
can't say that's an
the
OR, no? Ang DR is not an OR.
in
not
big
an
hospitals, in big hospitals, the delivery room can be converted into an operating room. But I don't think in health centers they
Not
do.
the other way
Yeah.
around. Okay, we're going to have to take a short break, and at this point, we're going to bring in this next segment. We have Father Jerry Manlangit, an expert in bioethicisms, isms, bioethics. And of course, we have Dr. Sanchez, who is both a lawyer and also an obstetrician, if I'm not mistaken. Nako, maganda bakbakan po dito. Ladies and gentlemen, stay with us. We'll be right back. When we come in, we'll tackle the dilemmas that surround this issue. Wait, hold on. This is not the RH bill, and if I'm not mistaken, that has been passed. So we'll continue, go forward, and understand the issue. Stay with us.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?